The hot baby. It is more common for a sick baby to be cold, but a high temperature is just as worrisome. A temperature more than 37.5 degrees is too high for a baby. Sometimes the baby is hot because he's too warmly dressed, or the room is too hot. But the baby could also have a serious infection. This video will show you how to evaluate and care for the baby with a high body temperature. Wash your hands and the thermometer. Then check the baby's temperature. If you don't have a thermometer, feel the baby's belly. The skin may feel hot and look flushed. The mother may report that the baby's mouth is hot on her breast. Notice if the baby is too warmly dressed. Then ask the mother how long the baby has felt hot. Did she have any problems during her labor or birth? Did her waters break early? Has the mother herself been sick or had a fever? Ask about other danger signs such as lethargy, poor feeding, and convulsions. The mother reports that the baby has felt hot since last night. She is also concerned that he is not feeding well. The thermometer reads 38 degrees. The baby is too hot. A normal temperature is between 36.5 and 37.5 degrees. Check the baby. First, observe his tone and activity level. Check his breathing rate. Breathing can be more rapid with an elevated body temperature. Check the baby from head to toe for other danger signs, for a bulging fontanelle, for jaundice, abdominal distension, umbilical redness, and skin pustules. The baby has an elevated body temperature and poor feeding. There are no other signs of illness. Try to cool off the baby briefly by removing his clothes. If the baby is hot due to the environment, his body temperature will become normal quickly by simply cooling him off. It's not recommended to give paracetamol or sponge baths to the young baby. The temperature has not come down. Don't delay treatment, especially if the baby has other signs of illness, in this case, poor feeding. Refer this baby to a higher level facility. Before the baby leaves, give the first doses of intramuscular ampicillin and gentamicin. Notify the facility, write a referral note, and arrange transportation. Make sure the baby feeds as often as possible and is warm with skin-to-skin contact throughout the trip. Every effort should be made to refer the baby. If referral is not possible, do your best to care for the baby in your clinic, though realize that this care is not the same. Treat the baby according to your national guidelines. The preferred regimen is IM gentamicin once daily for 7 days, plus amoxicillin by mouth twice daily for 7 days. Check the baby at each daily visit to be sure he's gradually improving. An alternative option is giving IM gentamicin once daily for just 2 days, plus amoxicillin by mouth twice daily for 7 days. See the baby on day 4 to determine if he's improving. Advise the mother to give only breast milk every 2 to 3 hours and keep the baby warm. Counsel her to return to the clinic immediately if the baby's condition worsens. Remember, a temperature higher than 37.5 degrees is too high for a baby. Cool off the baby briefly by removing his clothes. If the temperature remains too high or If the baby still appears unwell, the baby is sick and needs to be referred.